Is another stay-at-home order possible for LA County if the trend lines that you outlined don't improve? And if so, how soon could the closures be imposed?
Yeah, thanks for that question. I'm sure it's top of mind with almost everybody who lives here and works here. We can't take anything off the table. There's absolutely no certainty of what exactly is going to happen next. We do know for a fact, though, that we have to do everything we can to protect the healthcare system for everybody, not just for people who are sick with COVID-19, but people who have other illnesses that require care in our hospital setting and in other healthcare facilities as well. And that's why nothing can be off the table. Do we want to go back to a safer at home order, really closing everything down again? Absolutely not. None of us want to go back there. But if we had to go back there because we were getting to the point where it was pretty clear we were going to overwhelm the healthcare system, we would have to keep that option on the table. What I can honestly just say as a person who lives here, it's kind of in everybody's hands right now. We slowed the spread before, and that's why I say it's in everyone's hand. We did slow the spread before. We slowed it very successfully here in LA County, the largest county in the country, managed to actually slow the spread. And we slowed the spread at a time where we actually didn't know as much as we know today about how to protect each other. So we know more. We know how important it is to wear those face coverings. We know how important it is to keep our distance from other people. We know how important it is to do basic and control. And we know how important it is for those businesses that are open right now to protect their workers, their customers, and their visitors. These are things that are for certain. And it's for certain that if we do a really good job on implementing all of the tools that we have at hand, we can get back to slowing the spread. And that makes it much less likely that we return to safer at home. We don't have a lot of time, though, because we're already, as you see, every day that we talk to you, you see we're increasing the burden of care that's required for hospitals to provide. And at some point, you turn that corner where you're actually expecting hospitals to provide way more care than's possible. We can't get there. And so if of the steps we're trying to take collectively don't work to stop us from getting there, we're going to have to dig deeper into the toolbox around the strategies of sort of should be open and what should be closed. I think right now it's pretty clear that the message is out there about trying to slow the spread by closing some sectors and then asking some sectors to move activities outside wherever possible. And I'm hoping that the strategy works, but it goes hand in hand with everyone doing their part. And we'll take the next question.
And that is from Haley Winslow with Fox 11. Your line is open.
Hi, Dr. Fair. Thank you very much for my question. Some of the health experts are warning of potential long-term health problem of the virus affecting people of all ages. Can you shed any light on, even if you recover from COVID-19, possible long-term effects, not only blood clots and potentially strokes, but for lung damage?
Sure. It's such a good question. I think it's such a stark reminder of the fact that, people may in fact recover in the sense that they get to leave the hospital, but many people, thousands of people have been left, as you noted, with debilitating illness that seems to last for a much longer period of time than they expected or we anticipated at the beginning of the pandemic. So I do think it's important for everyone to take note of the fact that, just like you mentioned, there are now numerous just anecdotal stories, like, oh, I heard this from a friend, but numerous research studies that point to the fact that for a subset of patients, recovery has been very, very difficult, and there have been lingering serious effects from the illness. And as, again, as scientists and researchers struggle to better understand how this virus interacts with human beings, I think one thing is clear is that as with other viruses, different people have a different response to the virus and a different path towards recovery. So I think as Mr. Solis showed us at the very beginning, this can cause so much heartache, this virus. And, a lot of people just go around saying, most people don't get seriously ill. But most people isn't everybody, and lots of people, lots of people end up pretty sick from this virus. And some of them, as you're noting, have a very, very long and arduous road on their recovery journey. So I appreciate that question. And as we learn more, we'll be able to, perhaps be able to pinpoint some of the reasons why for some people the recovery journey is particularly difficult and causes a lot of lingering serious side effects. We have time for one more question.
Thank you. That is from Nathan Solis with Courthouse News Service. Please go ahead.
Yeah, hi. Thank you for taking the questions from all of us. I was just curious to know if there have been any research on the quality or characteristics of the virus in Southern California, if anything about it unique, and that could explain the rapid increase of infections.
Dr. Ferrer.
It's a question to answer definitively because, as everyone has read, there are now, ample studies that indicate that there have been at least one serious mutation, but that mutation doesn't seem like it's associated with more serious illness. I think we just have to continue to learn more to be able to answer anything definitively about what's happening here in LA County, as well as how does that compare to what's happening in other parts of the country and other parts of the world. So, we try to stay on top of, again, what we're reading and what we're learning. We're really blessed here because we have a lot of researchers right here in LA County that are looking at sort of the sequencing of the genes to try to really understand what's going on. But I don't have a definitive answer yet on is there something special that's been happening here. And again, we're in the process of doing another round of seroprevalence, another round of serology testing. I think the testing will start later on this week. We'll have a third round of results that we'll be able to share that I think, again, allows us to do some comparison with what we're seeing here in LA County and what's been seen in other places that are doing surveillance serology testing. Remember, that's the antibody testing that we do. So, I hope we continue to learn more and more definitively answer this question. But now we'll turn to remarks in Spanish from Supervisor Solis.
Buenas tardes y gracias por acompañándonos ahora en esta conferencia de prensa. Mi nombre es Hilda Solís, por estos últimos 15 meses en grupos grandes con personas fuera de su casa. Mejor conéctanse con ellos viralmente. No se permite reuniones en persona.
All right, guys, just want to say thanks again for being here with us on News Now. I'm just going to skip ahead, see if there's any other portions that are not in Spanish here. It looks like they are going through this whole press conference in Spanish for those people in their area who speak that language. So just want to say thanks again for being here with us on News Now. Here's that live look at those numbers across the U.S. But we have a ton of content to get to here this evening, so I want to jump right into it. Something we haven't gotten to here yet today is our daily interview with Dr. Mike, thanks to our Fox 29 Philadelphia station.
Dr. Mike Srigliano, Penn Medicine, joining us out of Philadelphia. Good to see you, Dr. Mike.
Always a pleasure, Thomas.
Let's start with some encouraging news on the vaccination front. The first vaccine tested in the U.S. kind of revved up people's immune system.
Well, this is very encouraging news, and it couldn't come any sooner with all that's going on right now. Moderna's vaccine is showing great success in terms of safety and production of antibodies. In fact, the patients that they are studying, they have found that the antibody response was similar to those folks who actually had the virus. So this is excellent, excellent news. It appears to be safe. Now what they're going to do is give it to a whole lot of people, and we'll see if it actually can mitigate, reduce symptoms and risks of the natural infection of this virus, which is what we all need and are hoping for.
Yeah, this is a partnership with Moderna and the NIH. Side effects, fever, aches, those are normal and acceptable, right?
Well, Thomas, with any vaccine are always going to be some side effects. and some are more than others. You get a low-grade fever, you can get local soreness, you can feel achy and feel fatigued. But I'll tell you what, Thomas, I'd much rather have those symptoms for 24 hours or so than end up on a ventilator in an intensive care unit. So this is the way to go. And we must say this, Thomas, that vaccinations will get us through this. And there has been debate for years by people who don't believe in vaccinations. This is not the time for that. And I'm taking a stand here because if you look at one of the best ways in public health to prevent illness, it is through vaccination, whether it be measles, mumps, rubella, whether it be border pertussis, whether it be polio, whether it be anything. If you look through history and time, this prevents death and illness, and this is the way to go.
I mean, are you concerned? It's a good point that too many Americans simply won't take the vaccine out of concerns about its safety.
Well, I'm very concerned about that. We had that problem even before the pandemic, where people just either think they are dangerous, they are a part of a conspiracy, they are just not, they don't work. The bottom line is that we must base everything on science, just like with masks, Thomas. We know now that wear a mask, it reduces transmission dramatically. And with vaccination, we can get out of the hole that we're in right now.
And we talk about what's next as far as this clinical trial, this vaccination. I know 30,000 people will receive it in about 2 weeks. Is that the final phase of this trial?
Well, that phase can take up to 6 months. So yes, if that proves to be a proof of concept, if you will, that patients who get this vaccine have safety and efficacy, then they will be ramping up production. Now, that's a whole nother can of worms, Thomas. How do we vaccinate the entire planet? How do we do that? Well, I think what's going to happen is there will be shared information. There will be manufacturing that will gear up with many, many different manufacturers all throughout the world to get this under control. And it's a matter of production and a matter of getting people to get the vaccine. If we can do that, then I think there is light at the end of the tunnel.
And we talk about the efficacy rate as what would be an acceptable rate, 50%?
Anything better than zero, in my opinion, Thomas. I deal with this every year with the flu shot. And people will say, well, Dr. Mike, the flu shot was only 30% effective this year. Well, guess what? 30% is better than zero. And if it helps a certain percentage of patients get a more mild illness, then let's do it. Because right now we have nothing in terms of a vaccine. And this is really what we need to do to get through this.
One final question on the vaccination front. Is it possible we could see a vaccination in multiple doses?
Well, Thomas, there's a lot of unknowns out there. We don't know whether antibodies last, whether they're protective. There's some disconcerting news that came out this week from England showing that people who actually had the virus have, in some cases, antibodies that are not protective, that reduce in either efficacy or number after just 30 days. So there's a lot that we need to learn about this. But if it means that we get multiple vaccination protocols, fine. Let's do it. Let's make it happen. And let's move on with our lives. I don't know about you, Thomas. I'm kind of tired of the whole pandemic thing. I'm tired of the coronavirus. I want to move on. But it doesn't mean we just ignore the coronavirus like we seem to be doing. We have to deal with it head on in a scientifically proven way.
Have we been able to crack that very important question? Why do some people who are exposed develop symptoms while others don't?
Well, Thomas, not really. There are people, at least in my own practice. I have 80-year-olds who thought they had a cold and they were positive. And I have had 50-year-olds who run and work out and take care of themselves very well who ended up on it for a month. It really depends on the individual risk factors, how your body responds. We're seeing this with kids. Certain kids who had the virus end up developing this fairly dramatic immune response. Not every kid does this happen. So we need to learn more, and boy, will we keep learning. a lot from this. It's almost tantamount to trying to get the moon, Thomas. If you think about it, yes, the objective was getting to the moon, but if you think about the technology and the learning and the knowledge and the rapid advance in education from that project, it had led to many, many, many different outshoots, if you will, whether it be calculators and all of that. So we learn a lot from this, and there is a silver lining with this coronavirus.
Yeah, we're learning more every day. We see the studies that are coming out. I know there's new research. It was published in the Journal of Adolescent Health that found that 1 in 3 young adults, Dr. Mike, is at risk of severe COVID-19, and smoking plays a big part in that risk.
Well, Thomas, we've known that smoking and vaping are both not a good thing even before the pandemic came. And if you remember, there are upticks and outbreaks of young people developing severe lung disease, some of them needing transplants after vaping. And we were really looking into the chemical components of some of the vaping oils and material that went into the lungs. And so the young people who get this virus can get very sick, and those who smoke or vape are at especially higher risk of developing problems.
And we're also seeing reports that as far as our younger population, the young, not only getting sick, but they're experiencing symptoms longer. Do we know why?
Well, we know why. Many people are experiencing symptoms that are long lasting. Some of the patients that I have taken care of, who I've seen in the office after illness, continue things like cough, continue to have findings on chest x-rays that indicate early fibrosis or scarring. So there's a lot to be said for the fact that there may be long-lasting effects, and not to forget the emotional toll that this is taking, not only in people who got the virus, but also the quarantine, the whole debate about school, kids being home, a decrease in their education and goals. All of that will have long-term effects.
Let's talk about schools for just a moment, and perhaps a misses fact here, because there are some reports out there who say our very young simply can't get sick. They can't be exposed.
Well, that's not necessarily true, and we know that for a fact that young people can get sick. Some young people can die, and some young people will need lung transplants. We've seen all of that. I'm not making it up. It's true. It is the truth. It is a true. Okay? So that being said, we need to find a way to safely educate our young people and not have them get into trouble. But also, Thomas, and I'm a big stickler on this, our teachers, our administrators, our people that are involved with our children, many of them have underlying health problems. And in humble opinion, they need to be educated on proper use of protective personal equipment, just like doctors and healthcare workers are. They need to be made aware, educated on proper techniques to protect themselves when they are in the school, and that means wearing masks, and in my humble opinion, protection for the eyes. When I see patients, I wear these. And the bottom line is that we know for a fact, and we've talked about Thomas, that the virus can get into the eyes and lead to an infection.
Yeah, your mouth, your nose, your eyes as well. So as a doctor, as a parent, do you think it's safe to send our child in the fall?
Well, Thomas, the homeschooling issue was very challenging for my two children. I have a 12-year-old and an 8-year-old. And so I believe that if we do it right, if we stage it properly so that there is social distancing, kids need to wear masks that are high quality, that are cloth, that are 2-layer, that are high thread count, that even may involve 2 different materials like cotton and silk or a cotton panel. If we do that, I think we could get through this safely, but it's going to be challenging, unprecedented, and really a frontier. We are learning. We're all going to learn. We're going to make mistakes, but the bottom line is, I think it's in the best interest of everyone to try.
Yeah, and a reminder to parents once again, I mean, talking about the symptoms in our young here, they have developed an inflammatory syndrome very similar to Kawasaki disease.
Thomas, if I have a child, especially if they're in a school setting, they develop a fever, we are not going to say, well, it's just a cold. In this day and age, I want patients to call me with any symptoms of upper respiratory infection, fever, muscle aches, rash, anything like that needs to be dealt with immediately, because the earlier the diagnosis in that particular condition, the children's multi-system inflammatory syndrome, that needs to be dealt with early on, and better outcomes occur when it is dealt with, diagnosed, and treated early on.
And as we head toward the fall months here and back to school, who's eligible, who's should be getting a flu shot this fall season?
Everyone over the age of 6 months is eligible for the flu shot, and everyone should, unless there is a good reason why. You can't, whether it be that you had an allergic reaction to it before. There are conditions like Guillain-Barré where you have an immune condition that maybe precludes you from getting it. Those are the types of patients that you worry about, but leave that to health providers and experts to decide whether your loved one should get it. But the bottom line is, for the vast majority, we all need to get the flu shot.
Something to consider. Our daily reminder, Dr. Mike, on staying safe.
Well, Thomas, I want to mention this. There was recently looking at 2 hairstylists who treated a large number of people, cut their hair, styled it, just like you, an amazing hair. And the bottom line is that they wore masks and they did not transmit the virus, even though they were later found to be positive for the virus. So my take-home message today, Thomas, masks. Everyone needs to wear a mask. It is the way to go. Social distance, mask, wait for the vaccine, and we will get through this.
Added layer of protection. Dr. Mike Sirigliano out of Penn Medicine, Philadelphia. Great to see you, Dr. Mike.
Always a pleasure, Thomas. You take care.
Thank you.
All right, and because that interview did come from our Philadelphia station, why don't we head on over to Pennsylvania? That way we can get our daily update from the Governor, Tim Wolf, along with his health officials on COVID-19 in their state.
We have 2 people. Dr. Levine is with me, and we have Dr. David Rubin, who's going to be on too. On TV soon. So let me start. During the past week, we have seen an unsettling climb in new COVID-19 cases throughout Pennsylvania. During the past week, that has especially been bad. When we hit our peak on April 9th, we had nearly 2,000 cases that day, with other cases hovering around 1,000. That was our peak, 2,000. Medical experts looking at our current trajectory are projecting that a new surge is in the offing. And what we're seeing right now could soon be even worse than what we saw. We had 994 cases just yesterday in Pennsylvania. So before, we succeeded at flattening the curve back in the spring. And we did that by working together, all of us. And we actually broke transmission links. We got down to the point where we were actually in the 300 to 400 new cases per day. And Pennsylvania, as I recall, was one of the continues to be, but still was best states in the country when it came to dealing with the COVID virus. We didn't know about the virus then as we do now, so we had to take a broad approach, sort of a blunt instrument approach to eliminating points of contact. But with our current rapid increases, we need to act again, but this time we have more knowledge and we can act in a more focused manner because we have a better sense of how this virus is affecting Pennsylvanians. Through contact tracing, we've identified 3 catalysts for our case increases. This is where we think the case increase is coming from. First, some Pennsylvanians have been ignoring the mask wearing requirements and social distancing when they're visiting Pennsylvania bars and restaurants. They are unknowingly spreading or unknowingly picking up the virus. And this carelessness has resulted in pockets of super spreading. Second is state travel. both by Pennsylvanians who are returning from places they visited out of state, by out-of-state folks coming to Pennsylvania to visit us here. And the third catalyst for this new upsurge is a lack of national coordination. And that has been states in the South and Southwest especially not committing to the things they should have done to keep this virus from spreading. Unfortunately, this virus does not respect state boundaries. And so we are paying the price in different ways for what states and other places have not done. We see that, for example, in testing. Sometimes takes as many as 10 days to get test results back. And that's not because of anything we've done. It's because national test places are being overwhelmed by the cases that they've seen in these other states. We're paying the price. We did everything we should have done. We were responsible, and yet we're paying this right now. So the result is that other states have become petri dishes for COVID-19 during the time when we were all working hard here in Pennsylvania to suppress the spread. Some of these states actually now have hospitals at maximum capacity due to the COVID-19. This virus knows no boundaries, no borders, as I said, so it's been spreading northward and eastward across the country and has reached our Commonwealth once again, this time from the west, the south, and the southwest. Together, these three catalysts have turned our downward trend into an escalation. And we're already at a tipping point where we really have to act. We don't want to become Florida. We don't want to become Texas. We don't want to become Arizona. We have got to act now. So today I'm going to be signing an executive order that will implement the following mitigation efforts across Pennsylvania. First, restaurants will reduce their indoor capacity to 25%. The current outdoor dining rules remain in effect just as they are. Second, on-premises alcohol consumption will be limited to service with meals only. Cocktails to go and carry-out beverages are allowed. Third, telework must be implemented whenever possible. And fourth, indoor gatherings will be limited to people, and outdoor gatherings remain at a maximum of 250 people. As I've said, we are using the information we have gathered over the past few months to create these mitigations based on how the virus spreads, how it's spreading in actuality right now in Pennsylvania. We know that the virus appears to be primarily airborne, so we're placing more limits on indoor activities. We know that the virus spreads rapidly in crowds, so we're limiting crowd sizes in situations where people are likely to gather close together, such as bars. This is the virus speaking. The virus is making the rules here. We're just trying to anticipate what those rules are and doing what we can to reduce the risk that virus is going to do a lot of damage in Pennsylvania. Now, these new mitigation efforts are in addition to existing actions. They don't take away the importance of our personal responsibility to do our part, each of us, 13 Pennsylvanians, to reduce the possibility that we are spreading COVID-19. That includes wearing a mask when we're out in public. It includes washing our hands, using hand sanitizer frequently. It includes social distancing as much as possible. We have seen these efforts work during the first wave in the spring. They worked. And they're going to work again if we all do our part. So I want to say thanks to every Pennsylvanian for your continued patience and your support. I know all of us, I am and you are, eager to get back to life as normal. That's the way it goes. But this is what we have to do. It may feel like a step backwards, but it isn't. It's just a reminder we need to get back on the course of mask wearing, social distancing, and successfully mitigating COVID-19. Pennsylvanians should consider that even with indoor dining limited and bars closed, on-premises alcohol consumption, cocktails to go are still permitted, and there is no outdoor dining options. Small gatherings of friends in the backyard or at a local park, they're still permitted. And children and families are encouraged to responsibly take advantage of one or more of the 121 Pennsylvania state parks or other outdoor local and local fitness options. Children can visit local playgrounds, community pools. They can enjoy outdoor activities with their families. Gyms and fitness centers can remain open and are encouraged to offer more outdoor fitness options. I want people to spend time together, but I want them to do so while they're practicing social distancing, while they're wearing masks when required. When you leave your home and you're not participating in an outdoor fitness exercise, wear a mask. That passes is 1 minute closer to the end of this pandemic. That's what we're trying to achieve. And many researchers and many medical professionals are working diligently to find more treatments, maybe a cure for COVID-19. So thank you, Pennsylvania, for everything that you've done, every sacrifice you've made. Let's keep working together. Let's keep working together. I know we can to ourselves, our families, our friends, our businesses, and our communities from a further spread of COVID-19. Now I'm going to turn things over to Secretary Dr. Rachel Levine. Secretary Levine.
Good afternoon. Thank you, Governor, and thank you for your leadership and support. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 994 new cases of COVID-19 being reported, and this brings our statewide total to 97,665 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 6,957 deaths have been attributed to COVID-19 now in Pennsylvania. As I explained on Monday, we have seen counts increase in 43 counties in Pennsylvania, and the percent positivity has increased in 28 counties over a 7-day period. Over the last day, we have recorded our single highest day in tests being completed, with more than 8,000 test results reported. Currently, we have a total of 649 trained contact tracers across the state, including our community health nurses, local municipal health departments, and our committed volunteers. And we're working to increase that every day and every week. Through all of these efforts, we are still seeing alarming increases in cases of COVID-19 in 19 to 24-year-olds throughout Pennsylvania and in 25 to 49-year-olds in Pennsylvania. The actions that the Governor and I are taking today are designed to be surgical and precise to prevent repeating the cycle that we saw in the spring. As the Governor mentioned, we have gained a great deal of experience since the start of this outbreak, and have learned from best practices from other states and counties in Pennsylvania. New York and New Jersey, as well as Allegheny and Philadelphia counties, have taken a similar approach. In addition, states like Texas, Arizona, Florida, California, in the past have not taken this approach and are now seeing the surges. This action is necessary now to stop the spread of COVID-19 and stop the disease transmission cycle from repeating. We know what will happen if we hold fast and wait until cases rise exponentially before taking action. The numbers would continue to increase and our entire state would then potentially have to quarantine. And so by acting now and making these specific and targeted mitigation efforts statewide, we can get ahead of the curve and ensure that not only will our hospitals and healthcare system be available to patients, but that our economy will survive while still saving lives. There are things that you can do right now to stop this cycle. First, wear a mask. Really, if you're thinking that you might need to wear a mask, don't think so hard. Wear the mask. If you're in a store where people are not following the mandatory mask order, make a choice to leave. If you're getting together with people who've been pretty vocal about not changing their lifestyle and are refusing to wear a mask, make a choice not to see them. As much as our efforts are about laws and mandates and orders for safety, they're also about your choices. Pennsylvanians want to be at work. Pennsylvanian children want to go back to school, but it is our actions as a community that will impact our ability and their ability to do those things. So be safe. Adapt your activities to protect against COVID-19, and please wear a mask. Here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing happy birthday twice. Please use sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And please don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Programs Get Help Now at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to now remember is stay calm, stay alert, and stay safe. And now it is my pleasure to introduce David Rubin. Dr. Rubin is a pediatrician. He is director of the CHOP Policy Lab and director of Population Health Innovation at the Children's Hospital of Philadelphia. Dr. Rubin.
Governor Wolf, Secretary Lean, thank you for having me today. As the director of our Policy Lab and our Population Health Program for Health System at the Children's Hospital of Philadelphia that sees over 600,000 children and adolescents every year, our teams mobilized very quickly in March and April to begin developing local area forecasts at the county level, because even though it was extremely important that we have national and state data that really impressed upon our communities the magnitude of what was coming, it was also important, we foresaw, that we would need to develop local area knowledge so that we could get areas opened as soon as possible and as safely as possible. At CHOP, we represent the interests of working families. We knew that our families would be facing the direct impacts of COVID, particularly to caregivers. We have a lot of grandparents throughout the state, that our teachers and our staff with schools would be thinking about their own risks, and that children did not live in a vacuum. And as much as we knew that we needed to get families back to work and children to schools, we also recognized that we had to do it as safely as possible. The models that we have now developed, which forecast the disease activity and particularly the viral activity throughout 500 counties in the United States, and which can be found at policylab.chop.edu, along with other resources for families, have actually allowed us to understand how this virus moves across the country and how it sometimes and often spares rural areas, and even as we struggle in some of our more urban areas. The model has also helped early on. We were one of the centers that were really trying to challenge state governments to reopen some areas safely that were ready, even as our cities remained more and were struggling with disease activity in their local areas. Our models now have been helpful to the White House Coronavirus Task Force as we've been helping them to understand potential impacts of stronger mitigation strategies to try to curb this next wave of the epidemic that has been sweeping the country. And so for a long time, we've helped advise and consult to both state and national leadership to help people make important decisions that affect the lives of people every day. But we also promised that we'd be back if we saw incontrovertible evidence that the resurgence was coming. And sadly enough, I'm here to let people know that that evidence is now extremely clear. And even as we focus on Texas, Arizona, Florida, and other areas of the Southeast and Southwest, it is very clear that the disease resurgence is moving quickly into the Northeast region and to the upper Midwest. And if I can share my screen, I'm going to show you exactly how we don't rely on single pieces of information to make that assessment, but we see it through neighboring regions. We see it in multiple counties sharing the same disease resurgence, and we see it in our testing positivity Secretary Levine has discussed. The goal here, I remind everyone, the goal here is we have about 6 weeks left in summer, and all of our school reopening plans of our teams at CHOP have been very much involved, are entirely dependent on us keeping disease transmission down so that we instill in our public the confidence that they can safely put their children on a school bus and return to school, and that our teachers and our staff can feel that they will be safe when they educate our children. So with that, I'm going to try to share my screen, and if I can't, I'll give you the general comments, and I'm going to start by focusing in on Allegheny County. So I'm going to assume that that people in the room can see what I am sharing now on the screen. Is that correct? Lacking someone tell me otherwise, I'm just going to start preparing my comments. We just see you. Oh, you just see me, so you can't see my screen. Let me try. So I don't think this is going to work on the screen here, so I will just contextualize the comments. Over the last couple of weeks, we've seen significant disease resurgence in the Pittsburgh area, not just in Allegheny County, but in the neighboring counties around them. We have applauded as we've watched people in the Pittsburgh area begin to distance more and do a lot of the individual activities that Dr. Levine has spoken about today. And they may, in fact, be curbing the epidemic that is quickly spreading there. However, this was not an isolated outbreak. Prior to the resurgence in the Pittsburgh area, we've seen multiple cities now in the state of Ohio, including Cleveland, including Columbus, Ohio, with significant resurgence that continues to climb. They have widespread community transmission, which is washing over our western border of Pennsylvania in waves, particularly as people travel season of American vacations. And if that were only the case, we would have enough to be concerned about what was coming east. But even more worrisome now is a lot of the pressure from the south is really moving quickly up the I-95 corridor. We're seeing increased disease transmission in the Washington, D.C. metro area, in the Baltimore, Maryland area. Those areas just a couple weeks ago looked much more like us or New England, where it was fairly quiet. And within a couple of weeks, they now resemble more like the cities in North Carolina that have lost control of the epidemic. For people to view on our website, the Virginia Beach projection for the next 4 weeks, we'll see what epidemic transmission looks like, how quickly cases can grow within a region. Over the last week or two, we've now also been watching very closely the Philadelphia area, and it is very certain over multiple weeks, collar counties and the surrounding counties in southern Jersey are all now reflecting increased diseased activity and are conferring risk as well to Philadelphia proper. This last week or two, we've seen elevated transmission rates in throughout the Philadelphia area, and we're seeing very clear evidence of increasing case identification in Philadelphia. This is also not isolated to just Philadelphia and to Pittsburgh as well. Because of the increased risk now and transmission we're seeing throughout the state of Maryland, up the Route 15 corridor towards Harrisburg, we are now seeing significant pressure on York County and into central Pennsylvania. Simply stated, we are seeing now widespread community transmission throughout the north area. It's also extending up into northern New Jersey as well. And it's of sufficient concern now that if we do not act decisively in these next 6 weeks, we may not be in the favorable terrain we had hoped to be in to be able to convince and to assure the public that opening schools will be safe after Labor Day. Make no mistake, the time is now for action. And I'm going to hand back the decisions and the questioning back to Governor Wolf, to Secretary Levine, and I thank them for having me today. I'd be happy to answer your questions as well.
Questions, yes.
So, Why is this a statewide order after you previously stated that you were going to take a more targeted approach to counties that were seeing increase in cases? Obviously, the more rural counties are not seeing the same influx in cases. Why are those businesses being forced to occupy with the same limits as businesses in larger counties with more cases?
Okay, first of all, this is a very targeted approach because we know more about the disease, because we have contact tracing. We know where this disease is spreading from. We also know that the disease is not respecting county, state, national boundaries. So we are trying to do what we need to do in a targeted fashion. As for the geographic spread, most of the counties in Pennsylvania actually are seeing an increase. Not to the extent that Allegheny County or Philadelphia County, but this is something that extends across the Commonwealth. But as Dr. Rubin and Dr. Levine said, we're to make sure that we do things we need to do right now so that when schools it comes time to open, we get back to the fall, that we're in a position to do that. Again, we're trying to follow the dictate of this virus, and this virus is saying, I'm back. And you might have done everything you needed to do in Pennsylvania, but you couldn't control what happens in these other states. You couldn't control who's going to be going across your state borders. You couldn't control who's going to congregate in bars. I don't like this any more than anybody else does, but this is what we're trying to do. This is what we do if we want to stop this in its tracks right now, so that by the time we get to the opening of schools, we can do that. I don't know, Dr. Rubin or Dr. Levine, you want to say anything?
Well, to echo the governor's comments, I think that, and the data Dr. Rubin is presenting, I think the threat is statewide. And so that is why this is a statewide effort. And as the governor said, this is a targeted mitigation effort. This is not red, yellow, green, where many, many different segments of the population were affected. We're really looking at the data, not only in Pennsylvania, but the data nationally is that the virus is starting in younger people, so the 19 to 24 age group, but also the 24 to 49 age group, and that is particularly being spread, and sometimes in these super spreader events, in restaurants, in bars. People are not practicing social distancing, they're not masking, and they're putting themselves and their families and the community at risk. And that's what we've been seeing in Allegheny County. We've had extensive discussions with Dr. Bogan, have strongly supported the mitigation efforts that Dr. Bogan has put in place, strongly supported the mitigation efforts that Dr. Farley in Philadelphia has continued, actually, over the last number of weeks. And I just want to contrast the efforts that Wolf's leadership is taking in the administration to Florida. Because in Florida, you can see what happens when you don't do any mitigation efforts and you basically let the virus burn. And so they are seeing, last week was, Saturday was over 15,000 cases. Yesterday, I think it was over 10 or 11,000, close to 10,000 today. You can see that their hospitals are in many different areas around the state. Their death rate is now increasing. That's when you just let this burn. We cannot be Florida.
If I could just follow up, what if this, people are going to be asking, what if this doesn't work? What if we don't get to where we want to be? Mm-hmm. Are we going to see more businesses if that were an occupancy limit, brought down further? Because many of these restaurants will say we can't survive at 25% occupancy.
So it is absolutely, and the governor can speak about this as well, extremely challenging for those businesses and for the people and the employees and the owners of those businesses, and we certainly realize that. But this is where the virus is spreading now, and this is where we have to take action. It's hard for me to predict what we're going to do in the future. We are positive and optimistic that this action will be successful, but we cannot be Florida. We will not let the state go to be Florida and letting it burn, and so we'll do whatever is necessary. This is what is necessary now. Governor?
No, I couldn't agree more. I keep saying, this whole process, we've had an array of choices, and they've all been bad. What we've been given is what the decision as to what's the less bad option. Clearly, this is a bad for the businesses we're targeting here. The question is, would we be in even a worse position if we allow what happens in Florida, where no one's going to restaurants, they're not going to bars anymore. And as long as the hospitals are being overwhelmed, they're not recovering from the disease. I mean, none of those things is good for any part of any economy. We're to mitigate, and yes, it's focused and targeted right now. It's a bad thing. Let's hope we do this and get through this phase as quickly as possible. If we do nothing, I can guarantee you we'll be a lot more like Florida than we looked like Pennsylvania by acting decisively early on. I want to get through this, and we need to get through this quickly. This is where the virus is being spread, and that's where we need to do our work. Yeah.
You mentioned that a lot of these mitigation efforts are targeting indoor events, but as Dr. Rubin said, there's only a few more weeks left of summer. What's going to happen when it starts getting cold? Do people need to plan that they're going to keep staying outside, or will they be able to have more things inside?
Yeah, well, two things. First of all, we're trying to actually stop this virus in its tracks. And right now, because we are taking, we have the information that we know where this seems to be spreading, we're targeting that right now. If we do that, we don't have to be as focused on this when we get into the return to school. And that's the hope, that we can actually do what we need to do now so that we don't have to, I mean, we don't want to wait another 4 weeks. Let's act now in the hopes that this makes it so that we don't have to do draconian things when we get to the fall. Yes.
The spring of the virus, the first cases appeared here, and the numbers of the cases started after. It seemed like the overriding goal was to protect the healthcare system, to limit the virus spread so the healthcare system wouldn't be overwhelmed. The last 10 days or so, the hospitalizations in Pennsylvania, according to the dashboard, have been pretty steady. They haven't skyrocketed, they've been steady.
That's right.
So if the state's hospitals are doing pretty much okay, why do a statewide measure?
First of all, the objective is to keep people safe. And one of the means to doing that is to make sure that our healthcare system, just one of the means, was to make sure our healthcare system, do everything we could to make our health not be overwhelmed. And we did that. And I think you're right. Right now, we're doing that. If we don't do anything right now, if we do what Arizona and Texas and Florida did, we're going to see that healthcare system, just as they are, being quickly overwhelmed. We don't want to get to that point. So that wasn't the goal, but it was a means to the goal of keeping people safe. So far, we've done a good job, and I think our healthcare system is in pretty good shape. Remember when I keep bringing this up, we were using ventilators as a reflection of how many ventilators were we using compared to how many we had. We have 5,300 and some ventilators there in the healthcare system right now. As of today, we are only using 88 of them for COVID-19 patients. Now, part of that's because the standard of care has changed. But part of it is because our healthcare capacities, we have millions of N95 masks and millions more on the way. We were concerned about gowns. We now have over 1 million, maybe 2 million gowns. We're looking for warehouses. Hospitals and healthcare systems can't take any more inventory because they have a lot of inventory. So we have the capacity now. And I think that's a good thing. We get to the point where we were concerned back in the early stages that our healthcare system would be overwhelmed, because that would be one more reason why this virus was going to overwhelm us. We're trying to keep people safe. We're trying to keep people safe here with what we're doing right now. And part of that is to make sure that we let our healthcare system be overwhelmed.
Follow-up, the Associated Press reported that the county governments have received an email from your office saying that bars and restaurants that are not serving meals will be closed. Are you closing bars or ordering bars and restaurants that don't serve meals to be closed?
Yes.
Okay.
But I call them nightclubs. I mean, I think if you have a place where you can go get a hamburger with the beer, that's fine. I don't care what you call it yourself. But if you're just a dive bar or a nightclub and you do is serve drinks, that's not going to work. Yes.
I'd like to get Dr. Levine's latest assessment and perhaps Dr. Rubin.
Yeah, why don't you pick on Dr. Rubin here too? That'd be great.
Regarding this surge that we're seeing, what is your latest assessment on what is happening in terms of the medical impacts? Are you seeing any signs whatsoever of people getting sicker, or the trend go up, or the hospitalization?
So I'll speak briefly, and then I'm going to toss it to Dr. Rubin. So there have been some increased hospitalization rates in Allegheny County, but you have to understand that all that gets delayed, meaning you don't usually contract COVID-19 and immediately get sick that you have to go be in the hospital. First of all, the incubation period of the virus is 2 to 14 days, on average 5 days. And then after a number of maybe a week or 2 weeks, then you're getting sicker and sicker and you end up in the hospital. And then if someone might pass away, often that can be several weeks after that. And so that is what Florida saw. Florida saw increasing numbers, and then a time later, several weeks later, now that their hospital is challenged, and then now they're just starting to see the increase in deaths in Florida. So any report, I want to clarify this, any report that the virus is less severe or less virulent, I completely disagree with. There is no evidence that the virus is less severe or less virulent than it was before. In fact, there is some genetic evidence, although it's controversial, that it's actually somewhat more contagious. That the variant that we're seeing, primarily that came from Europe, might be a little bit more contagious, but that we have not seen the hospitalizations because until the last number of weeks we didn't see the numbers. Now they're starting to see some small increased numbers in Allegheny County, and we, as the governor is saying, we don't want to wait until exponential growth is going up and then our hospital system is challenged. Dr. Rubin.
Yeah, I'd like to just add a couple of things because at Policy Lab we've had the benefit of watching the cautionary tales of what's going on in the South and other regions of this country. We've worked very closely and hard to get communities reopened and keep them open, and it's been one of the an extremely common calculus is we're going to keep pushing through our gates until we see our hospitals full, and that has been a rabbit hole. Has not worked at all. Leaders in the South have failed to recognize these increasing transmission rates. And the time for action is when you're doubling from 50 to 100 cases, not when you're doubling from 500 to 1,000 cases a day. We've also seen transmissions now where younger people are getting infected and then infecting older people in their community, people being fatigued, et cetera, not distancing enough, which has been the most important strategy that we have. And that, again, delays the hospitalizations rising. And the problem that happened in Texas and Arizona and now in California and in Florida is by the time their leaders recognized, oh my gosh, we're 85% full, they're in the thousands. And those thousands are doubling every day. And when that happens, you get overrun. So waiting for the hospitals to fill is not the way to try to use a dimmer switch, the fuse blow dimmer switch when you're in the thousands of your cases daily. The time for action is now, and with the urgency around school reopenings just around the corner, if we do not get community transmission rates down, we're really threatening the most important reopenings around Labor Day.
Governor?
Yes.
Governor Wolf, you said earlier that it's imperative that Pennsylvanians do their part, but just like we've seen since the beginning of the pandemic, there are people who aren't going to follow that. So what about the nightclubs and the bars and the patrons that visit those locations? Can be a consequence to not doing what the order states?
Yeah, there are legal consequences. We actually have liquor enforcement officers that have made thousands of decisions and actually issued some warnings. For the most part, though, most establishments have actually done the right thing. Second thing is that I think, if you've all noticed, but more and more people are wearing masks out there, and more people are, again, I think it's like seatbelts. More and more people are saying, yeah, I don't like this any more than you do, but that virus is out to get me, and I want to reduce the risk. And so more and more people are doing the right things, and I think part of what is going to happen, people are just going to say, I don't want to assume the risk of getting this disease. So maybe instead of going to that nightclub tonight, maybe I'll stay home. And the more people who decide that, the better we're going to be. And I think that's what's happening. Right now, when this whole started back in March, we were in a very different place than we are now. Right now, people are wearing masks. People are actually looking out for each other in a way that they weren't just 3 months ago. And I think we're learning about, the more we learn about this disease, the more each and every one of us, 13 million Pennsylvanians, are doing the right thing. As we do the right thing, I don't care what your economic incentive is, you're going to find it hard to to remain. You're going to be shamed into doing the right thing. Are there going to be exceptions? Absolutely. Are there going to be that no enforcement officer has the time to go to? Sure. Are there going to be pieces that figure out ways to skirt this? Yeah. But for the most part, we are moving more and more in the direction where all of us are, in fact, working together to attack and defeat this virus.
And Governor, follow-up to that, what should residents do if they want to call out that person? Because that's a question we're getting in the newsroom all the time, is where can people report businesses and individuals who are not following guidelines?
That's a great question. I think individual residents, if they see something that's wrong, they ought to report. And the more they report that, the more the people who are responsible, local law enforcement, state law enforcement, are going to do something about it. I think one of the things that happened early on is nobody was standing up, or few people were standing up, and so someone would say, "Hey, I'm going to be a tough guy. I'm going to stand up, open up. This is my First Amendment right," or whatever. And it's like, I think if someone stands up and says, "I don't think you ought to be doing that," you're going to be finding more and more. And yeah, I think you're right. I want to do the right thing here. That's what we're really aiming for. This is going to work when 13 million Pennsylvanians, all of us, decide that we want to hold on to our lives. We want to reduce risks for our loved ones, our neighbors, our coworkers, all those things. And as that happens, I think you're going to fewer and fewer people, as we're already finding, want to violate the law. Yeah.
Is that me?
Yeah.
Thanks. So thanks for being here. I wanted to ask about testing. The last time I was here was in May, and that was where Dr. Levine said that one plan for the fall plans for the fall included having rapid response testing. Right. I was just wondering, is that still, are there still Pennsylvania firms working on that? And is that
absolutely
likely for the fall?
Absolutely. We thought it was going to be August. I'll let Dr. Levine talk about it, but this is something we are working on. We actually, Department of Community and Economic Development, working with a specific company. We're taking a gamble here, but focused on a Pennsylvania company where we control our own destiny and say, we want a rapid turnaround test. What does it mean when you get tested and it takes 10 days to get the result? The answer is it means nothing, because within that 10-day period, you might have tested negative, and you get the test results back, you might be positive, but you don't know it. So we need to get a test that's easy to administer, hopefully oral, that you can do yourself, and where we get an accurate results within, say, 15 to 20, 25 minutes. We're not there yet. There isn't in the country that's there yet. The company we were working for originally, we thought maybe by August. It looks like they're now saying October. We're not holding our breaths, but we need to work on that, and that's the kind of testing we have to get toward.
What's the company?
It's called, am I allowed to say this?
I don't know.
I don't know.
Was it publicly bid? How did the company?
That's a good question. We'll get back to you and figure out how we did that. This is one of those areas where I'm trying to move as quickly as I can, not go, wait and spend a lot of time. So I am sure if there were some things that we did that moved faster than in ordinary times, I'm sure that we did. And it is a gamble, and the hope is that it works for Pennsylvania. I'm trying to keep Pennsylvanians safe, and this is something we desperately need. Every state needs it, but we need it here in Pennsylvania. We cannot, as we're seeing right now, we cannot continue to rely on national testing organizations.
Yeah. Governor Wolf, I have two questions. One's logistics that you can answer yes or no. So even if bars have outdoor seating, but they don't sell food, does that mean they're still going to be closed for this?
The order is, even if you're outdoors and you're serving alcohol, you have to serve food with it.
Okay, that's great. And my next question is, I know that 6 weeks from now we're going to have that benchmark of the school year opening. And I know many teachers are concerned, thinking that they won't be safe going in the building, but lots of parents are concerned because they need their kids to go. It's obviously, I don't know, tell you, huge issue. Are you prepared to pull the plug on the school year in person if we don't reach these benchmarks and we still keep up in it?
Yeah, I mean, ultimately, I don't think it's going to be me pulling the plug. It's going to be exactly what you said. Teachers not wanting to come back to school. It's parents not wanting to send their kids to school. The same thing is happening in universities. We can wave all the magic wands we want and flick all the switches we want. If they don't make individual decisions, I feel it's safe to go back, they're not going to go back. And that's why what we're doing here is so important. We need to nip this in the bud. We cannot as Dr. Levine calls it, let it burn like Florida. We've got to take decisive action so that we have a fighting chance to be able to get to a point where they're going to feel comfortable and confident that they can send their children to school.
Yeah. Governor, thank you. The Red Cross, as part of the testing that you all have, is now doing the antibody testing. Concerned that those cases would come back as a positive, which means they've had COVID, now they have the antibody. Can you give Pennsylvanians an assurance that those numbers are not being counted twice as a positive COVID and positive for antibody?
I'll turn to Dr. Levine too, but yeah, we actually, I think that came up back in March or April, and we understand that there are two different types of tests, but a negative in one is not the same thing as a negative in the other, and you can't conflate those things.
So first I'll answer that, and I just want to mention about the general testing. So we know exactly who has the antibody tests, and we know exactly who have had the PCR tests, and so we don't count them. But also I want to emphasize is that the any antibody test results is listed as probable case. And so we only make decisions when we're deciding about mitigation and other factors. We're only making those decisions based upon confirmed cases, and that are only the PCR results. And so it is, and we separated all of our websites. So it is apples and oranges. We're only looking at confirmed cases when we look at county case counts or regional case counts and things when we're making any type of decision like we're making today. And we make sure that we don't double count when we look at our total numbers. I want to mention in terms of you mentioned about the testing. So, you know, we have reporting 28,000 tests, the most we've ever reported that have come back today. That's very good news that we've been increasing our testing. We've increasing our testing in terms of our community testing, but also we are testing every patient and every staff member in every nursing home in Pennsylvania, and we're working to complete that by the 24th of July. And then we're working with the Department of Human Services to test every patient and every staff member in all the other long-term care living facilities sometime in August. And then we're going to retest on an annual basis depending upon the results and then their location. Very pleased with the increase in testing. We've worked with many other companies such as Rite Aid and Walmart and CVS in terms of testing. So we have a capacity to do about 1,000 tests a day at our laboratory in Exton. Those are priority tests that we do, for instance, with a priority nursing home. Might have some issues, and we get those back in 24 to 48 hours. The hospitals and health systems, of course, do their testing. They get those results back in 24 to 48 hours. The concern that the governor was mentioning is the national testing laboratories. So, you know, many community tests, they're being obtained at potentially a federally qualified health center or one of the that has testing. They're sent to national companies, for example, Quest and LabCorp. Now, they are doing a fantastic job, but they are overwhelmed with tests now. I mean, it's particularly tests coming from California, from Arizona, from Texas, from Florida, but not only those. And Dr. Rubin probably tell us the other states that are particularly impacted and affected. So the lag time for those national test results has crept up to a week, and then sometimes more than a week, and that limits the utility of the results, as the governor was saying. We do have calls in to Lauren Quest to talk about the challenges and to brainstorm with them, but this is a national issue in terms of the number of tests that are coming to these national companies, and will really national response in terms of helping them decrease their turnover, decrease the time in terms of results.
The cases that are reported every day, I mean, can you give any kind of sense of how up to date that data is if we're seeing this lag? How are the lags affecting our new case counts, and is there reason to believe that case counts are really higher than they are, or will surge as we work through the backlog?
So, I mean, most of the labs are not 2 weeks, most of the results are not 2 weeks out, but many of them are certainly within the last week. But there are concerns with that lag time. Dr. Rubin, would you like, you had talked about your concerns about the test lag time.
Well, we used to think that, you know, wherever you were today or what you saw today in your tests, probably 2 weeks behind. And, you know, with the increasing lag times and increased reports of people waiting 7-10 days, first of all, at the individual level, it's hard to make decisions about how to get kids back to school or people back to work based on those types of decisions. And people live with a lot of anxiety. That's bad enough as it is. But from the perspective of trying to be ahead of this epidemic, when you add extra delays to the tests that we're not now seeing, the surges in the South, that means we may be further behind than just 2 weeks. And so whatever we're seeing today, we're probably a few weeks behind what's actually happening on the ground. And that should be us, and why we need to be a little bit more decisive and ahead of the game, if you will, in terms of responding right now.
Yes.
The 25-person indoor limit applied to religious institutions?
No. Governor John?
That was actually the question.
Yes.
Right now, the hospitals right now, the health system are really making a case, like right now, to try to persuade people to come to the hospital. Do you have any, in light of what we've been talking about today, do you have any concerns about that right now?
Let me just say that actually is a problem with restaurants and bars and retail establishments and manufacturers who want to give the people who either work there or are going to be customers or patients or students the confidence that they can come back. This is a general problem, and the problem you're talking about is one that I've heard a number of hospital executives talk about, and that is, how do we people confident that they can come to, of all places, a hospital to be treated for things that they might just sort of let slide and stay home. They're afraid of going to a hospital right now. They're afraid of doing so many things. This is why what we're doing here is so we've got to take steps to actually build that confidence that we can get back to as close to normal as we possibly can, and that's what acting decisively and early right now is. Dr. Levine?
So I would agree with the governor 100%, is that we want people to get the primary care and the other services that they need. We want people, if they have hypertension, if they have diabetes or heart disease or lung disease, to see their doctors. We want children to get their pediatrics and to visit their family physicians. We want children to make sure they get their necessary immunizations, which is absolutely critical. So we want all that primary care and all that secondary and tertiary care to continue. We want them to feel safe to be able to go to the hospital, to have quote-unquote elective procedures. That elective doesn't always mean that it's really elective, but it's something that could wait a couple weeks but to be done. So we support the hospitals completely. We want people to see their physicians and their healthcare providers and to get the care that they need, which, as the governor said, highlights why it's so important to put in this targeted mitigation now, so that we don't threaten our hospitals the way Florida has, where now they can't do those, and they've started in Texas in some areas. They're starting in Arizona the crisis standards of care because their hospitals are overwhelmed and threatened. If you wait to that point, as Dr. Rubin was saying, you've missed the boat. Dr. Rubin, would you like to comment?
Yeah, a couple things. I remember. I just wanted to note that back in March and April, when I returned to my own pediatric practice, I remember being terrified. I think all of our staff were as well. Our nurses, our nursing assistants, we were worried. I mean, we all felt the same way, terrified that we were going into a very uncertain environment. And then to watch what Children's Hospital did and what our health providers did to provide the adequate protective equipment, the protocols, and the decision-making really helped relieve a lot of anxiety. And I think of the same way for our teachers. I feel safest when I'm at my practice right now, and Pennsylvanians should feel safe going into your health systems. They've worked very hard to make it a safe environment, and their protocols are pretty aggressive. But I also say to the teachers out there, our job as Pennsylvanians is to get our case transmission rates down. That's step one, to reduce the disease burden so people feel safe and the like they're going to accidentally get infected goes way down. The second thing is to say is to have some protocols for masking and distancing in your schools. And if you feel confident about your protocols, and with low disease transmission, I think our teachers and our staff should feel just as safe as our nursing assistants and doctors do when they walk in the doors of the Children's of Philadelphia.
It sounds like you don't have any immediate concerns that we're headed for a problem then.
The goal, as we've been saying, is to prevent that, which is why we're putting the mitigation.
I have a concern about that. If we do nothing, we are going to overwhelm our healthcare system. That's why we need to act now. One of the reasons we need to act right now. Okay, thank you.
One quick question. A lot of people in the legislature support a bill about the right to know law and it being effective or right to being answered during an emergency. Earlier in the spring, you said the process is sort of held secondary with one. Will you sign that bill that the entire House approved and the move forward in the second half?
No. I think that bill has some flaws. I am for transparency, and I will stack my record of transparency up against the members of the General Assembly any day of the week. I think that particular bill has some flaws. Let's actually get to a point where we are transparent. And by the way, we are answering all right to know and open records, I think, right now. Is that right?
Is the Capitol going to close under this new order, and so will the right to know process change? Like, will state workers be teleworking now?
To the extent they can, but I'm not sure that open records is necessarily limited by teleworking. To the extent you need to have specific concrete files, if there's still enough people who are going to be working that can do it. We'll figure out how to do that.
What about what limited it in the spring, though?
Excuse me?
I thought that was what limited the right to know in the spring. People were working from home, and so.
But we had fewer people working, period. We had more people working from home, that's true. We also had people working, and that put a limit on it. We needed to figure out a way to deal with this, as we did in so many other of the processes in light of this COVID-19 pandemic. I think we've done that now, and so moving forward, I think we should be in pretty good shape. Thank you very much.
All right, guys, going to turn things on over to our Fox 5 Atlanta team as they gave us a coronavirus spike for you right here on News Now.
Stolen four-wheelers at the center of a months-long investigation, and local authorities say the thieves are crossing county and state lines. But we begin with the latest details in our fight against COVID-19. In the last 24 hours, nearly 3,400 new cases of the virus have been reported statewide. Good evening, I'm Courtney Bryant.
Thank you so much for joining us, Tom Haynes. About 23% of all of those new cases come from 4 counties alone: Gwinnett, Fulton, DeKalb, and Cobb. Tonight, there are currently more than 2,700 in the hospital battling the deadly virus. Since yesterday, 28 people have died. For the first time, data reveals that 1 in every 10 Georgians have tested positive for the virus since the pandemic began. Tonight, a huge step forward in our fight against COVID-19.
This evening, researchers at Emory University reported anxiously awaited findings from phase 1 of the first human trial for a vaccine. Fox 5 anchor Christine Spiro joins us now. And Christine, these are encouraging to say the least.
Yeah, that's right, Courtney. Scientists say after getting the shot, patients produced antibodies to fight coronavirus. Now the question is whether it will protect against infection, how long those antibodies last.
It has also shown that the vaccine is able to induce a good immune response.
Emory, Kaiser Permanente, and the Vaccine Research Center at the NIH are testing this experimental vaccine made by the biotech Moderna.
Within 6 weeks, they actually had a vaccine that was ready to be given in humans. And by mid-March, we had the first subject enrolled.
A 65-year-old Decatur man was one of the first enrolled to test this experimental vaccine.
So the vaccine is 2 doses. One is now, and again, another dose in 4 weeks.
Local trial participant Norman Hume received the first injection in April, then the second in May.
Kind of getting a flu shot, they just kind of put in your, the arm of your choice in the upper deltoid muscle. So I have to keep a diary of any other thing, like pains or headaches or any nausea.
Have you had any of those issues?
No, I haven't.
Unlike Hume, researchers say more than half the study participants reported flu-like reactions to the shot.
As far as side effects, we've seen the subject mentioning pain at the injection site, but also mentioning some systemic symptoms such as feeling fatigue, having some chills, having headaches.
Some of those reactions are similar to coronavirus symptoms, but they're temporary, lasting about a day and occur right after vaccination. Overall, scientists say they're pleased the vaccine provided a hoped-for immune boost.
We were pleasantly surprised that the vaccine was well tolerated. I think we were also pleasantly surprised that it did induce an immunity similar to convalescent people that recovered from the disease.
Phase 2 is still ongoing, and Phase 3 will start around July 27th. It's a 30,000 study to prove if the shots are really strong enough to protect against the coronavirus. If you're interested in participating in the vaccine trials, we've provided a direct link to our website. Just go to liveatlanta.com. Courtney?
Fascinating stuff, Christine. Thanks. Allegations of falsifying COVID-19 tests at an Athens Clark County hospital have been cleared. 4 nurses filed a lawsuit against Landmark Hospital of Athens, claiming administrative staff retested patients who had already positive and sent them to a lab. An investigation by the state found the hospital did not.
New tonight, an Atlanta area church chooses to close its doors for in-person for the rest of the year.
The pastor of North Point Community Church made the announcement on the church's Facebook page. Fox 5's Brooke Zahner spoke to him about his decision.
Like many other churches, North Point Community Church has been reaching people solely online since the coronavirus pandemic. They had planned to open their buildings up this summer, that is, until coronavirus cases started going up.
Our churches have not closed. We've simply suspended gatherings Sunday morning at 9 and 11 o'clock.
Pastor Andy Stanley says the choice to keep North Point Community Church's closed through 2020 was not a hard decision to make.
And everybody agreed we cannot do contact tracing. We cannot guarantee the safety of everybody who comes in the building.
Since the start of North Point has been reaching people online and over Zoom, even in people's driveways and the church parking.
I didn't have to talk anybody into this. They were like, no, that's not what we're about. We are outward facing, so let's outward face and do things that we've not had an opportunity to do before.
The announcement came in this video to the church.
We've decided to suspend in-person adult worship services for the remainder of the year.
Pastor Stanley acknowledges not everyone is happy about the decision.
For others of you, this is like an unnecessary precaution, perhaps a lack of faith on my part.
In a non-COVID-19 world, thousands of people attend church at one of North Point Ministries' locations. They say they will do small gatherings, but trying to bring people back to the building isn't a good idea for them.
We're going to do some limited physical gatherings between now and Christmas for sure, but we're just not going to open up our buildings, primarily because our responsibility is to keep people safe.
Stanley says he sees time as an opportunity to reach more people and help the community.
We're committed to doing things for our community. And if we open, we may accidentally do something to our community that's not positive.
At this point, in-person services at North Point Community will resume again in 2021. For now, Stanley says they will continue to reach people virtually. Reporting in Atlanta, Brooke Zahner, Fox News.
Developing tonight, the Trump administration has reversed its decision that would have forced international college students to leave the U.S. if they were only taking online classes this fall. The unexpected announcement from ICE came just as arguments were set to begin during a hearing. Several states and universities had filed lawsuits against the government to block the rule. Many students will be taking all online classes in the fall, and now some parents are scrambling to find tutoring and other resources.
And as Fox 5's Deidre Dukes explains now, they're worried their children will suffer academically without in-person instruction and are now looking for additional support.
Clayton County School Superintendent Dr. Morsees Beasley took to YouTube Tuesday afternoon. The school district's plan to help ensure families are ready for virtual learning when classes begin August 10th. Clayton and Atlanta Public Schools among the metro area school districts opting to begin the year with virtual instruction. Fulton County Schools has offered parents the choice of sending their children to school or to learn online at home.
It's leaning for me towards going virtually, but while, it's leaning for me towards going virtually, but while, if I see what schoolwork needed to be turned in, what resources we had, how should I be helping them?
The O'Denny's are now searching for a tutor for their kindergartner and 8th grade student to help bridge the gap.
And having a tutor, somebody who may have an education background and could best help my kids.
All parents are being faced with something they never thought that they'd be experiencing.
Felicia Zorn, who is Director of Business Development for USA Test Prep, encourages concerned parents in search of a tutor to reach out to their student's school for recommendations.
There are systems and school districts out there that have lists of tutors that are available that are former teachers or retired teachers.
Zorn says there are lots of online resources available to help students and parents. Websites like USA Test Prep have content that align to the state standards and allow parents to track student success. Deidre Dukes, Fox 5 News.
And this breaking story just into the Fox 5 newsroom. The attorney for Justin Conley tells Fox 5 that Atlanta police have notified him this morning. They have 2 warrants for the 19-year-old's arrest. One felony murder, the other aggravated assault. This is all in connection with the death of 8-year-old Sequoia Turner. You may remember Fox 5 spoke with Justin Conley earlier this week. The teen admitting to Fox 5's Angelique Proctor he was present during this crime but did not fire his gun. He also says he witnessed the shooting. Conley's attorney says his client plans to turn himself in today. Stay with Fox 5 for the latest developments on this case and for the 8-year-old's funeral today. All right, CDC says it's time to mask up, like for real this time. In an editorial in the Journal of the American Medical Association, 3 top leaders at the agency say everyone should be wearing a face mask in public. The Fox Medical team's Beth Galvin joins us live now to talk about this. Beth, why such a strong stance now? Good morning.
And good morning, Caitlin. Well, I think for a couple of reasons. One is this surge that we are seeing in cases, a tremendous surge across the South and across the western part of the United States. And also because there is growing evidence, Caitlin, that masks may not just protect, we may not just be wearing a mask to protect other people. They may actually offer protection to us too from getting seriously ill. And there's this super interesting case out of Missouri that we're going to talk about. But I think that there's also this evidence that is growing of asymptomatic spread, Caitlin. So people who do not feel sick, who have no symptoms, who are just going about their lives not aware that they are positive for this virus or they've contracted this virus, who may be spreading the virus to other people because they don't feel sick. So we have a few things going on. We've got the surge, we've got the growing evidence masks may work, and we've also got the asymptomatic spread that might be driving much of this outbreak that we're going through. Caitlin?
And the CDC, Beth, just published a case, right? That case study that drives home how much difference masks can make. They're pointing to a story out of Missouri, right?
Yeah, so this is out of the Springfield area, a great clip salon, and I think you might remember this in May. It was a big news story. A couple of stylists who, as a part of the reopening, came back to work, were working and were wearing masks. The customers were wearing masks. Everybody was wearing masks. They got sick. And they still came to work. One got sick and was sick for about 8 days and continued to work. She infected her coworker, apparently, who continued to work for 4 days. So in all, we've got the numbers here. We had 2 stylists who exposed 139 clients, Caitlin, and 6 of their coworkers. All of those folks, though, in that salon, under the state rules of the reopening, were wearing masks. So 47% had on a cotton mask, like most of us are wearing. 46% had on a surgical mask, and 5% had on one of those N95 respirators, a medical mask. Well, the customers and they were with their with these sick, symptomatic, coughing, respiratory issue stylists for about 15 to 45 minutes. So the CDC went in and followed with local health investigators, followed what happened to these folks. And this is where it's really interesting, Caitlin. If you follow up with them, of the 139 people who were exposed, none of them developed symptoms. 67 of them volunteered to be tested for COVID-19. All of them tested negative, not one positive test in the group. So we're talking about, Caitlin, 139 people who were exposed to somebody who was symptomatic but wearing a mask. They were wearing a mask. None of those people, according to the CDC's report, got this virus. So it's just really showing that maybe there is a role in maybe the masks protect both ways, not just the wearer wearing it to protect other people, but it protects you too from wearing it. But I think the key, though, is that we've all got to be wearing it because you got to have protection on both ends.
I guess this is all a learning process as we go through this, right? And right now that the stay-at-home order has been lifted, we're seeing more people out and about, many with masks, all different sorts, some without, though. A poll has been tracking how people feel about masks since this all began back in March. How did people feel about the mask during the surge, during the spike?
So it's interesting. It's been growing each week, the number of people who say they've worn a mask in the last month. And this poll, or in the last week rather. This is a Gallup poll, and right now they're saying the vast majority of people are wearing a mask at some point. 44% saying they're always wearing a mask when they go out in public, 28% very often wearing a mask, and about 30% say they sometimes or rarely or never wear a mask when they're out in public. And interestingly, it has to do with sort of gender and where you live and your income and things like that. But women are more likely to wear a mask. Democrats are more likely to wear a mask, and people in the Northeast, where you are from, Caitlin, are much more likely to wear a mask than people in the South. And it kind of, the survey is showing, you know, this kind of growing political divide about masks that we're seeing. And, you know, a lot of people are seeing out there that it kind of goes along party line. Republicans less likely to wear a mask, Democrats more likely to wear a mask. And I think it kind of depends on whose message you're following in all of this. A lot of confusing messages at one time. Caitlin?
I guess all I'm noticing, Beth, is how stylish some masks are.
I know.
Jealousy.
It does help make wearing a mask a little easier, yes.
Thanks so much, Beth. Beth Galvin reporting live for us.
Okay, good afternoon, everyone. This is Susan Chana again with Emory University. Today we are going to be discussing the early results of a vaccine trial that we've been working on at Emory. We are one of 2 sites in the U.S. It is in conjunction with Moderna and NIAID. And today we have with us Dr. Nadine Rufiel, and she is the interim director of the Hope Clinic and associate professor of infectious diseases at our Emory University School of Medicine. And she is the principal investigator for Emory's Vaccine Treatment Evaluation Unit, VTEU, and this is where the vaccine trial is actually being conducted. I'm going to turn the briefing over to her, but as a reminder, please be sure that your systems are on mute. Many of the people on this broadcast will use it for later on for broadcast. And if following her briefing, we will take questions via the chat function. So please feel free during any time to start entering in your questions into the chat function. Dr. Rufiel?
Yes, thank you, Susan, and hello, everybody. So today it's exciting. At 5 o'clock, exactly 2 minutes ago, New England Journal of Medicine will release the prelim results of the mRNA Moderna NIH collaboration, which is a candidate for COVID vaccine. And then basically this is a phase 1, first in human. It started mid-March. It had enrolled many subjects. Those prelim results focus on the first 45 that were enrolled in 3 different doses, the 25 micrograms, the 100 micrograms, and the 250 micrograms, and a study population of 18 to 55 year old. And it had shown that the vaccine was well tolerated. It has also shown that the vaccine is able to induce a good immune response. And that's kind of the promising result.
This call is being recorded.
The phase 2 is still ongoing. And the phase 3 for this particular vaccine candidate will occur later this month.
Okay, we can go ahead. Dr. Rufiel, do you want to provide us with any additional background as to when we started this whole process as we wait for questions to come in?
Yeah, sure. I mean, this is, as far as vaccine goes, this is an extremely speedy timeline. Once the sequencing of the vaccine was found, immediately Moderna, in collaboration with NIH, start working on the vaccine candidate. And basically, within 6 weeks, they actually had a vaccine that was ready to be given in humans. And by mid-March, we had the first subject enrolled. And for those 45 subjects, they were all enrolled within the first months. So that only took between mid-March to mid-April. And, you know, to be able to publish those prelim results just 3 months after completing the enrollment of those 3 cohorts is really unprecedented.
we'll go to our first question. What can you tell us about the length of immunity and what are the side effects of the vaccine?
So the vaccine is 2 doses. One is given now, and again, another dose in 4 weeks. Most commonly, the side
Vulnerable children in low-income communities.
So as far as side effects, we've seen the subject mentioning pain at the injection site, but also mentioning some systemic symptoms such as feeling fatigue, having some chills, having some headaches. We've seen the side effects mostly with the second dose compared to the first dose. And then to go back again to your point, as far as the duration, probably not much. I mean, again, we're really had shown the antibody and the safety result up to 2 weeks from enrollment. So we cannot say much about the safety of the vaccine at 6 or 12 months. Just time will tell, or the duration of the immunity.
Dr. Rufial, the next question, how many of the phase 3 participants will be from the Emory site? Will they be from Georgia or other states?
Yeah, there will be hundreds of subjects that are enrolled between the whole clinic, between the Emory Children's Center and the Ponce de Leon clinical research sites. And that there will also be hundreds of sites across the US. So there will be opportunities for participants here within Atlanta to participate, but we're also trying to really engage the community at large within the state, and particularly communities that have been hit the hardest with COVID. That's the African American community and the Latinx community.
Dr. Rufial, how surprising would it be if a vaccine that produced neutralizing antibodies did not lead to some protection against infection?
Yeah, I mean, we don't have a vaccine against coronavirus. So that's really kind of a new type of vaccine that we're trying to study. So we don't really know what actually protects against COVID. We know with other respiratory virus that usually this type of particular antibody that you mentioned, the neutralizing antibodies, are really key for protection. I mean, again, it's just how long will they stay? What's the right level of protection? Remain to be determined.
Great. And what are you looking for in phase 3 that you were not looking for in other phases?
Yeah, no, that's a great question. Again, the study was first in humans, so really the goal of the study was to make sure that the vaccine is safe. In addition, we collected blood for safety, but also to understand better the immune response. With the phase 3 trial, the question will be, is the vaccine able to protect against acquisition of disease, able to protect against somebody who will acquire the disease but will not develop severe disease, compared to other volunteers that will receive just the control or the placebo.
And I think it's a similar question. What will you look at in phase 3, phase 3 study to improve the vaccine's effectiveness and to reduce the side effects?
I mean, based on the result of the New England Journal paper, the immune response was quite similar between the 100 micrograms versus the 250. However, some side effects were seen more with the 250 micrograms. So the way forward was to select the 100 microgram dose to be the one that will be tested in a phase 3 trial.
Do we have any sense as to whether the antibody response wanes?
So there are some publications out there on a patient who got infected with COVID that the antibody levels could decrease over time. Again, we don't know what the significance of that is. Will that make them at risk of reinfection? We don't know what other component of the immune system could also be protective in addition to the antibody, for example, like the T cell response. So just a lot remain to be understood about the disease and how somebody who gets exposed actually acquire the infection, and if they do acquire the infection, how severe it is.
With dengue, further exposure to the virus, including vaccination, leads to worse symptoms. Is there any chance that this could happen with COVID? Would that mean exposure after vaccination could worsen than exposure without vaccination?
Right, we don't know that yet, but that's a very important question. It's on enhancement of disease that's created by certain level of antibody. Our sample size was small. Nobody acquired COVID in the study. It's really just to base it on a phase 1 trial will be hard, but the phase 3 trial will be looking at that in particular.
Are you optimistic about the findings as you go into the next phase?
Yes, I mean, absolutely. I mean, those are good results. Which candidates will be the one that will protect remains to be determined. I think it's, while speed is very important and very emphasized in the media, I mean, I think having a vaccine candidate that work and is safe is really the most important part. So probably not necessarily being the first vaccine, but the best vaccine as far as the balance between the protection and the safety. And then perhaps we need multiple vaccine candidates. This is 7 billion of us, and if all of them will like to get the vaccine, we need to have enough manufacturing of doses. So it could be that it's an effort across multiple manufacturers to get this pandemic over.
Okay, and what was the most surprising finding in the research?
I mean, I think we were pleasantly surprised that the vaccine was well tolerated. I think we were also pleasantly surprised that it did induce an immunity similar to convalescent people that recovered from the disease. So that's an important point to emphasize.
And then you said it was important for members of the community to volunteer for the trials. And if someone's interested in signing up, how they can do that. I've gone ahead and put in a website that people who are interested in volunteering for vaccine trials can go to. Is there anything in addition to that?
Yeah, no, that's absolutely right. We're really encouraging people to sign up with the Coronavirus Prevention Network.org link. It's really important to make sure that all of us as a community sign up. It's also very important to see how the vaccine will work in the most vulnerable population. That's mostly the elderly or people at risk of complication from COVID. So thank you for doing that.
Yes. Is there more than one shot that is administered per person? Which side's dosage provided best results?
Correct. So it's hard to say if one dose is enough versus 2 doses, but we already know that 2 doses actually improve the immune response. So the phase 3 is moving forward with a 2-dose regimen separated by 4 weeks.
Do you know how many people have already asked to be part of the vaccine trial? Did you receive a flood of requests?
We did. I mean, through the phase 1 trial, we had received thousands of calls. I mean, obviously, the size of the phase 1 trial will not be able to accommodate so many requests, and we hope that the continued interest will remain with the phase 3 trial.
And is there any indication that test subjects were contagious after the initial injection?
So the vaccine itself does not contain a live virus. It just contained the genetic material that will produce the spike protein, which is the important part of the virus that our immune system recognizes.
What if the volunteers in phase 3 are very cautious and not many get infected with the virus?
I mean, that's definitely the risk of phase 3 trials. So, for example, advanced stage of testing had been done for Zika vaccine in Latin America, but it happened at a time where the pandemic died. So it was really hard to see if the vaccine is actually protective or not. That's definitely something that the phase 3 trial are looking carefully at to see how the pandemic will evolve.
Okay, great. It looks like that's all of our questions.
All right, guys, going to be bringing you one more update here before we get things ready on the YouTube side to shut down for the evening. Going to be headed out to San Francisco to hear their update on COVID-19.
Well, good morning, everyone. I'm Dr. Grant Colfax, Director of Health for the City and County of San Francisco. Today, I'm going to provide an update on the COVID pandemic in San Francisco, looking at health indicators and other data. Unfortunately, we are experiencing a surge in COVID-19 infections that is affecting our community's health and our reopening plans. As a result, we are forced to continue to pause our reopening plans until conditions improve. We have been, and we continue to be in a period of uncertainty. And I want to acknowledge that that is a really hard place to be. We all need to continue to do what we know works. We have flattened the curve and we can do it again. But if we do not, the consequences could be dire. In terms of where we stand today, both locally, regionally, and nationally, in San Francisco, we have 4,696 cases diagnosed of COVID-19 and sadly 50 deaths. In the Bay Area region, approximately 37,500 cases and 667 deaths. Across the state, 346,000 cases and over 7,000 deaths. And across the nation, cases and deaths continue to rise. 3.4 million cases and nearly 137,000 deaths. The virus is not only still out there, it is out there more than ever before. It continues to spread locally in our community and throughout the Bay Area region. We are working with researchers who are seeing the reproductive rate of the virus continue to climb above 1. Right now, we estimate that number is now approximately 1.3. That means that each person who is infected with COVID-19 is passing the virus on, transmitting the virus on average, to more than one person. It is key that we get that reproductive number to 1 or lower. It is key for us to move forward. Now, 1.3 doesn't seem that different from 1, that far from 1, but if we do not do better, we are looking at major problems by late August and September, with an average peak of 900 hospitalized patients by early October. And just to put this in some frame of reference, on our last surge in April, we peaked at 94 cases. This average scenario of 900 cases is nearly 10 times worse, and it is certainly not the worst case scenario that we could have by that time. Models show that we could have thousands of hospitalized cases by then. Today's tracker showed that there are 92 COVID positive patients in San Francisco hospitals. That includes 76 San Francisco residents and 16 transfers. Let's look at the health indicator. Let's look at the health indicators we are using to monitor our COVID-19 response in the city. These are available on the San Francisco Data Tracker, and you can reach them from our department's website. They are scored by color: green, yellow, orange, and red, to make it easier to see at a glance where we stand. And there is detailed data available for people who want to dig a little deeper. Right now, the indicators show that we have reason to be concerned. Our cases per 100,000, our case rate has increased to 7.7. That is in the red zone. Our goal is to keep that case rate at around 1.8. We are red. In terms of our hospital system, the rate of COVID-19 infections which really represents the slope of that curve that we worked so hard and successfully early on to flatten, that rate is now increasing at a 33% rate. That is red, a cause for grave concern. Our goal is to keep that curve increasing by less than 10%. Our other hospital indicators are thankfully still green. That is our capacity to take care of people across our 9 hospital systems in the city. Right now, we have 27% of our acute care beds available and 28% of our intensive care units available. With regard to testing, our testing indicator is green. We are averaging 2,950 tests a day across the city, with our far exceeding our goal of 1,800 tests. Certainly, as we are seeing across the region, across the state, and nationally, our testing system is experiencing delays in access and getting results, both within our city system and with private providers. Our numbers, however, are high at 2,950 in the green range. With regard to contact tracing, we are at level yellow, reaching 85% of cases and 85% of contacts. We expect that indicator to turn orange this week due to delayed test result reporting and our increases in cases. The contact tracing team is working hard to catch up, and we will continue to expand staffing of that program. In terms of our personal protective equipment, or PPE, we are on level orange, with 78% of the health department having a 30-day supply of PPE. I'm sorry, let me rephrase that. Across the health department, we have our PPE supply is 78%. Our goal is 100%. We are experiencing some issues in terms of obtaining PPE, likely due to the increased national demand for PPE supplies. San Francisco is not alone in these challenges. Across California, the virus is spreading at dangerous levels, with new cases and hospitalizations on the rise. This week, the state announced a complete rollback of some reopening activities, with additional restrictions for counties on the state's watch list. Approximately 30 counties are on the monitoring list as of today, including several in the Bay Area. And we know that the Bay Area region is an interdependent region where people live, work, and play across many counties. And we also know that COVID-19 knows no county lines. If any county in the region is in trouble, we are all in trouble. That's why a regional approach has been key ever since this pandemic started, and we continue to be in very close touch with Bay Area health officers across the region, sharing data and solutions to keep all of our communities as safe as possible. And it is certainly possible that if our conditions do not improve, a rollback may be necessary in San Francisco and other parts of the Bay Area as well, whether that's a rollback through local action or through state-determined watch list actions remains to be determined. But this is a tool that we can continue to use to improve the situation if other interventions are not working. We have always known that this is a possibility, given the unprecedented and uncertain situations we continue to face. Now, no one wants to be in the situation we're in. And as we look at the rise in cases, many of them are because people have started to gather with friends and family and others to socialize. And I realize how hard these months have been for us and the sacrifices all of us have made. These visits are really hard to resist. But the truth is that they are spreading COVID. Those birthday parties, the visits with grandparents or parents, cousins, the barbecues, they are contributing to a delay or rollback in reopening of businesses, or even the first day of school. Another key behavior that we all need to do is to cover our faces indoors and outdoors when people are around you who are not part of your immediate household. This is critical. Research shows that masking significantly lowers the rate of transmission if 80% of people wear them. Adherence to facial coverings and masking is so key. One cannot tell by looking at someone if someone has COVID-19. We know that many people are asymptomatic at some stage of their disease, and they can transmit when they're asymptomatic. Being safe, wearing facial coverings, social distancing, and using good hygiene is key to our success. The simple act of wearing a mask will slow the spread of the virus and could lead to lifting shelter-in-place restrictions. For those who are wearing masks, I thank you, and you are truly saving lives. For those who are not taking precautions, you are not helping. And the situation is becoming more serious every day. So please, wear a mask, do not gather, stay 6 feet apart, and wash your hands. These basic acts can make and will make a huge difference if we do this together. We have flattened, we even crushed the curve before. That curve is now escalating, and we all need to do better. Until then, our reopening is on pause. We are not able to continue to open up additional businesses, such as personal services, indoor museums, aquariums, outdoor swimming pools, indoor dining, outdoors bars without food, real estate open houses, and other activities that encourage people to gather and make it harder to wear masks and social distance. While it is hard to slow down the reopening that we all want so badly, the price we pay for moving too quickly is very high. Remember, this virus has no timeline. That is why it is up to us. And now is the time. Despite those very serious numbers that I reported to you in terms of our hospitalization, we have a window to make a difference. We can still drive that number to 1 or lower that reproductive number by those interventions I just went through. We have a window to do this. It will make a huge difference in our hospitalization rates and the number of lives saved. We have shown that we can join together to make a difference, and we need to do it again. Truly, the power is in our hands. And even in these uncertain times, we know for certainty what are the right steps that we need to take. We can have a thriving city with a healthy population and a renewed economy if we work together. Thank you.
Thank you, Dr. Colfax. Thank you, Dr. Colfax, in case anyone can hear me. This should be better. The first question, and I do just want to say to everyone joining us today that we did receive a number of questions, and we're going to take them in the order that they were received. And any others that we can't take in time, we'll simply take offline. Thank you for your patience. Dr. Colfax, the first question is from Christian Captain with KTVU. Can you please explain the role schools could play in the city's COVID-19 infection rate? The school district announced that students will be distance learning when school resumes August 17th. There has been a lot of talk on the federal and local level about getting kids back on campus. What will it take to get San Francisco kids back to class?
So one thing it will take is for us to be confident that we can reopen schools safely for those buildings to reopen. And certainly we are going to need to see a decrease in that reproductive rate and continue to follow the data and science to ensure that the support systems are in place, that people are able to physically distance, that people most vulnerable to the virus are protected in those settings. We issued school guidance last week, which really emphasizes the need to have safety protocols in place and followed using the best evidence we have in terms of transmission. So we will make a decision about whether it is safe to reopen those physical spaces, depending on where we stand with the virus and with our surge in the city when the time comes.
Thank you, Doctor. From Aaron Alday with the San Francisco Chronicle. The governor issued new orders this week to try to wrestle the California surge back under control. The order includes statewide closures of bars, indoor dining, and other activities, but those weren't happening in San Francisco anyway. What places or events are currently the main sources of infection in San Francisco, and how are you addressing those sources?
Yeah, so we think it's a combination of factors that are increasing the number of cases in the city. One is we think that there are there's increased activity in terms of the social gatherings that people are having. And we really need to ensure that people are taking the precautions and not making those visits, not having those birthday parties, not having those barbecues moving forward as much as possible. So really focusing on the prevention and education, neighborhood by neighborhood, street by street is going to be so critical. And we are reinforcing our work with community partners and ensuring that they're community champions to ensure that people have the resources and the knowledge they need to be safer. The other key components of this are that we continue to see infections among essential workers. And we think that may be due to certain workplace conditions where safety precautions are not being followed. So we will be looking at that and enforcing, increasing our oversight and enforcement of the required precautions per the health orders that have been established. And we are also going to be looking at our existing businesses and aligning potentially with the state in terms of some of the activities that we may need to roll back. We're taking a look at the data right now to see what's potentially on the table for that. And then I would also add that we have known since the beginning of the epidemic that crowded conditions promote the spread of the virus. So really, again, working with community members in situations where they're multi-generational households to ensure that people are getting tested and people are taking the precautions that they need to protect themselves as well as their family members.
Thank you, Doctor. From Eve Beatty with Eater SF. Is the country considering a closure of outdoor dining and reverting to takeout only as a way to reduce gatherings? Are there any plans to begin to cite businesses or citizens for health order violations, as officials have ordered in Napa and Yolo counties?
So we're taking one thing that's clear from the data is that indoor activities are riskier than outdoor activities overall. So we know that the virus spreads more easily, more quickly in the indoors than outdoors. We're taking a look to determine whether this increase in cases is driven by some of the outdoor dining and outdoor dining. But we really think, again, this is more due to the non-adherence of some of the businesses rather than the risk that's taken the relatively smaller risk that's there if proper precautions are taken. So, if you're outdoors and dining and drinking and not adhering to the masking and social distancing rules, then of course transmission is at a higher risk. So we're taking a look at that, and again, looking at increasing enforcement of businesses and institutions, but we're also going to be careful not to be focusing on individual enforcement of individuals, but really looking at the potential enforcement, again, of institutions and businesses that may not be complying. And before we do the enforcement, doing a lot of education and support, right? So if businesses and others, especially small businesses, are not able to necessarily comply at baseline, what can they do to improve their compliance and support their workers to be more safe during this really challenging time?
Thank you. From Amy Graff, Doctor, are you ordering residents to stop gathering outside with masks if groups are keeping to under 10 or 12 people?
So at this time, we are encouraging people to minimize gatherings as much as possible, to wear a mask if you're in close contact with others, and to socially distance whenever possible. And certainly if people do gather in these small groups, that they gather outside is much safer. So those are the key components to this right now. And we know that there's a lot of need to improve that adherence to the facial coverings, the social distancing. I think we know, and we've seen, particularly when people know each other, they're good friends or family members, but they're not members of the immediate household. It's hard to wear a mask. It's hard to keep socially distanced. We want to hug people. We want to engage. We don't want to think that a loved one who's not part of our immediate household or a good friend may be infected with COVID-19, which is why we really need to get these messages out and support the communities most affected by COVID-19 to drop this reproductive rate below 1.
Thank you. Abby Sterling with KPIX. How will the current situation affect the decision to reopen indoor pools for summer camp?
So we have put a pause on any additional reopenings, and that would also include outdoor pools at this time.
Thank you. And from Mallory Moench with the San Francisco Chronicle, what surge sites are ready to be set up?
All right, guys, we are going to be turning things around here this evening, and just wanted to say thank you again for all of you who are here with us on our YouTube stream and on coronavirusnow.com, and for those of you at home. We do have more content coming up for those of you at home, and also on coronavirusnow.com. So we do have a lot of different updates coming from different cities. Plus, the very first thing we're going to be bringing to you is a coronavirus special from our Fox 2 Detroit station about the Michigan mask issue. So if you're going to be sticking around, we do appreciate that. If you're with us on the YouTube side, we're shutting things down for the night, but just wanted to say thank you again for being here with us each and every single day. We do appreciate all of our viewers and all of you who have subscribed to our page. We will be right back here tomorrow morning. Mike Pilar and myself, Christy Larson, will all be bringing you the latest news and updates from across the country. So once again, YouTube side, good night, guys. Thanks for being here. And for those of you with us at home or on coronavirusnow.com, don't worry, we have more content coming your way in just a few minutes. All right, so for those of you with us still, thank you again for being here. We do appreciate all of our viewers who tune in to get the latest COVID-19 news here with us. And the very first thing I want to go to, as I mentioned, was talking about the state of Michigan. Earlier we played you the governor's update, but this is a special done by our Fox 2 sister station in Detroit, talking about the mask issue that they have in the state. And we just want to say thank you again for being here with us on Fox.
Governor, when you take a look at the upward trajectory, are you leaning more towards phase 5 of reopening, or are you leaning more because of the numbers backwards towards phase 3?
Well, I can tell you on Memorial Day, Michigan was one of 2 states in the nation that was on track to contain COVID-19. The aggressive actions that we took paid off. The people of the state took it seriously and did the right thing. And because of that, we were like one of only 2 states that was colored in green on the national map. Now, if you look and see kind of the rolling averages, 7-day rolling averages, you know that we are in red, just like a lot of other states. We're not in the darkest red like Arizona and Texas, but it's concerning. And so if this trend continues, then it's likely we might have to roll back. And that's what I'm trying to avoid. I don't want to go back. I don't think any of us does.
And Governor, talk about this new executive order when it comes to masking inside of public places. What does it mean?
It means think about the usual rules of no shirt, no shoes, no service. Now it's no shirt, no shoes, no mask, no service. It's really that simple. Simply by wearing a face covering, we can drop the likelihood of COVID spread into negligible numbers if everyone's wearing a mask. 2 people who are masked, if one is sick, it's very, very low likelihood that the other's going to get COVID-19. But if only one of them has a mask, even if it's the COVID patient, the other one can still inhale droplets from a cough that might seep out the side of a mask. But if they're both masked, they're a lot safer. And that's why every one of us has to act as though we are carrying COVID, that we're thinking of others, we're thinking about ourselves, and we're thinking about the people we live with, our loved ones.
And we saw President Trump wore a mask when he was visiting Walter Reed. Talk a little bit about that. Were you encouraged by seeing that?
I was very pleased to see it. I've been asking the White House, encouraging them to really maybe perhaps even adopt a federal mask order. I think that would be a really smart thing. But they haven't embraced that yet. But the fact that the president was donning a mask when he was at Walter Reed, I think, was incredibly important. I went out of my way last week to acknowledge people like Dick Cheney and Mike Pence and Mitt Romney for wearing a mask, because we got to take the politics out of this. This is about our health. It's about our safety. It's about getting our kids back in school, and it's about limiting the economic pain that we've already suffered.
Governor Gretchen Whitmer, thanks for your time today.
Saline, Michigan is a quiet town in Washtenaw County, and that's the way the people who live here like it. But now Saline is in the news. A number of cases of COVID-19, all connected to a house party over the 4th of July weekend.
The Washtenaw County Health Department has identified 43 new cases, the majority of them connected to a large house party in early July in the Saline area. Young people between the ages of 15 to 25 have tested positive for the virus.
I would expect that to happen if somebody got together like that. They're just not being careful, and they really ought to be.
Fear is a powerful thing, so, it scares everyone.
As every region in the state is seeing an uptick in COVID-19 cases and a statewide mask mandate now in effect, Governor Gretchen Whitmer weighing in on the dozens of cases connected to the house party in Washtenaw County.
There are so many potential interactions that could have happened with each of those people in the days from the party to when they got tested and got their positive result, that's how COVID-19 spreads.
Large groups of people in enclosed indoor settings is considered much higher risk compared to being outside and being able to practice social distancing.
And that's why we stay away from everybody.
In the early days of the global pandemic,
both my wife and daughter had it. My wife, she ended up, she was sick. My daughter, she showed no signs. So there's 2 people in my house that had it. I never got it.
Despite having 2 immediate family members who contracted the virus.
Would you feel comfortable going to a party of 100 people?
Yeah, I would. Would I wear a mask? Probably not.
In Saline, Camila Mary, Fox 2 News.
We are in Macomb County today talking to Sheriff Anthony Wickersham about the new rule that went into effect here in the state of Michigan regarding wearing a face mask. As we all know, the governor signed an executive order last week making it a mandate for all Michiganders to wear a face mask inside all indoor public places. That includes restaurants, malls, barbershops, boutiques, hair salons. All of the above, you are now required to wear a face mask when you walk inside those indoor public places. We spoke to Anthony Wickersham, who has made a statement, but he's also providing more clarification. He is not necessarily saying he will ignore this new rule. What he is saying is he cannot respond to every single phone call his department may get going forward of someone not wearing a face mask at an indoor public place. What he is saying is if a situation gets out of hand, that's when he steps in. Here's more from the sheriff.
If the business tells an individual that they can't come in or, they have to wear the mask, and they refuse either to wear a mask or refuse to leave the store, instead of getting into a conversation.
And Michigan State Police, therefore, you can make an official complaint in a very safe way without having to coach anyone about not wearing a face mask. In Macomb County, Josh Landon, Fox 2 News.
Detroit is a national model for having dealt with COVID-19.
Mayor Mike says the proof is in the numbers.
We were losing upwards of 250 people a week. This last 7 days, the first 7 days of July, we had one death in this city.
After moving forward in this fight against a deadly virus, Mayor Duggan does not want Detroit